Welcome back to Three Docs in a Dumpster Fire. I'm Dr. Megan Babb. Joined with me
Dr.
is
Meredith Rishwain
and Dr. Grove.
Hi.
And today we are going to tackle physician burnout. We're going to talk about that. It's a definitely a huge issue amongst our colleagues, and something that we
have all experienced.
Yes.
True.
And I think the important message here is to potentially not provide excuses for the healthcare system and why things are the way they are, but to provide maybe some context into why physicians seem externally rushed, distant, maybe a little bit less engaged than what we're used to over the course of the past couple decades. I think it's kind of gotten worse. And then, of course, COVID, I think, made it to be what it is today.
100%. And also, I think we can hopefully give some guidance on how patients can get the most out of their visits if they're in the corporate medicine system or seeing a specialist, places where traditionally they might feel kind of those feelings, because in our practice we don't really have that anymore. We have the time to discuss everything on a patient's list. I've never uttered the words, okay, but what else do you want to talk about except in this practice? And so it's a very foreign concept, but for those that are still in the other system or seeing specialists in the other system, it's an important, we have a viewpoint that I think can help patients get the most out of what their visit entails or what they need.
Yeah.
So
Amen to that. Yeah, I was thinking the other day about how there's been a long time running a recommendation for patients to sit down and write out a list of things to bring to their doctor, and how mismatched, unfortunately, this is to the reality of the doctor's time. And of course, I understand the impetus for that recommendation, but realistically, it just sets up an expectation that is probably not going to get met. And in fact, probably will overwhelm the physician receiving that list or those questions, and just try to get people to understand, why this is not working, unfortunately, to bring up all of your concerns, but that hopefully we could help guide people to make the most of the time that they have with their physician, so that is well utilized, and use the system the best that they can for obtaining the best health that they can.
Yeah.
So, yeah.
Well, I truly believe that most physicians, if not all physicians, go into the practice of medicine with a very altruistic expectation that they're there to help people, and slowly the system just grinds and grinds away.
Yes.
And there's so many competing and conflicting factors that really collide with that idea that make it very difficult. When I was in corporate healthcare, I really had to work very hard to separate myself from what I was experiencing from a corporate healthcare side to my experience with the patient. And so I would literally have to walk into the room and remind myself that the patient is an N of one for them, right? And I need to make sure that they feel as though they're the only patient that matters in this moment. And that got harder and harder to do as the weight of the healthcare system rested more and more on my shoulders as my career progressed. And there's so many reasons for the burnout. It just is not anything that we could even tackle in one episode. You could probably take an entire season to really bring light to it. But what would you say is like your...
I mean, for me, it was always the time. So the expectation of rushing through patients. So, the expectations have gotten to the point where people, what were you doing? 26 to 30 patients in a day, which probably gives you 15 minutes tops with each of them. And then, of course, documentation. So the speed turnaround time of trying to establish rapport, trying to hear the whole story from the patient, trying to examine the patient, and then explain to them everything that they need to understand, and then document. I mean, it's, for me, the speed was just unsustainable completely. And then with the change with electronic medical records, I think that was the other piece of it. We both were in residency at the beginning of our training where we had paper charts still. And paper charts, though I was probably finishing later than Dr. Rishwain here, I still was leaving the office at a completely normal time and completing all of my work. And the second that the computers came on scene, that was really muddying my turnaround time. So I think, we spend as physicians way more hours on the computer than any of us thought that we would going into the profession. That the one-on-one time with patients is really what we crave and what fills our souls, and the time sitting in front of the computer, not at all. But those two things were very grating on me personally. So
yeah, just a few years ago, the AAFP, which is the American Academy of Family Physicians, came out with a study that showed that primary care physicians would need more than 24 hours a day in order to accomplish all the tasks that were, in that day. So that's definitely like impossible. But it just, the thing that was so hard for me was that the problems are very well known. It's not like you have a system that's broken and everyone's like avidly trying to figure out how to unbreak the system, how to fix things. It's that everyone's well aware of the problems, but no one's willing to do anything about it from a corporate level, right? They try with pizza parties, with, they try to make things cute by saying, pajama time. It's, when you're at home, you have your computer, you get to be in your pajamas. Like, wait a second, like my husband works too. Like, he doesn't have to have pajama time. Like, why does he get to complete his work at the end of the workday and not bring it home? And why do I have to be stuck with an additional 5, 6, sometimes 7 hours worth of work after the fact? And all the while, like, I was giving my patients everything I had in the moments in which I was sitting in front of them. I was sacrificing not documenting in that time period, right? So some physicians, like, they choose to use that time to also multitask and to document. Now, granted, we're seeing more in the way of scribes, which has been helpful. But we still don't even know the intricacies of how that's going to play out, of using AI, because it became sort of this like shotgun approach to like, oh, this will fix your scribe problem. But now we're creating potentially another problem, because now these AI systems have access to all of this data. It has access to our thought processes. It has our access to the way that we think in terms of like, how do we rule things in? How do we rule things out? All the while gaining more momentum and becoming smarter. Like, that becomes a whole other burden of like concern to be added on top of that. I personally don't think so. I don't know.
My hope is that it just does what I want it to do, which is give us more and more human time and less clerical time.
Well, of course, that's what we'd all hope that it would do. But I think the other thing that really weighs in on physicians, and this is something that from a patient perspective you don't see, is that it's not just seeing patients and recording the treatment and doing your notes. There are metrics. There are things that are being asked by the group for you that you have to do. It's not a choice. You have to do these things. You have to record the right blood pressures. You have to meet colon cancer screening metrics. There's all these check boxes, and they directly affect what they're going to pay you. And so as physicians, we're not only seeing patients and trying to treat them and document accordingly, we're also trying to make sure we hit all these boxes so that we can be paid what we should be paid. And that creates an additional level of burnout, because even when we finished our notes, there's these other things we have to do, trainings, make sure I hit this metric, and it makes it so much more burdensome on the physician, because you're never actually done. like in a day.
Right.
There's always something more that you have to do. Did you check your emails? Do you have to go to this meeting? You know, all these different things that add to that stress and that burnout. And God forbid, you know, you have to call a patient because they have abnormal labs or something like that. That's not accounted for in our day.
Right.
You know, these are things that we need to do or want to do as a good doctor, but they're also at the expense of our own time with our families. That's not accounted for in the day. And that contributes to burnout. When I hear patients tell me that a physician in a corporate medicine system called them to talk about their labs, the first thing I think is that physician must be really close to burning out because there cannot be enough time in the day in that kind of role where you're seeing that many patients to have time to do that without it being at the expense of themselves. And that's because physicians care that much and want to be, you know, want to be there for their patients, but it's just not fair that it comes down to we're sacrificing ourselves essentially to be good doctors to our patients.
I mean, that's right.
And let's talk about the context and how we've gotten here, because while we can't address the entire thing, like the elephant in the room is that this is the direct result of government not opening up enough residencies to allow more physicians to practice medicine, coupled with the fact that you have an incredibly greedy healthcare system that is a for-profit system that other people are profitizing off of. So off the backs of us, off the backs of the nurses, that makes it very difficult, because then the loss of autonomy that we talk about as physicians in terms of like not really having a say. I have autonomy to decide what blood pressure medication I'm going to start a patient on. Now there's guidelines that say what is best for different groups of individuals, but I don't feel pressure to prescribe a certain type of medication. What I feel pressure on is to make more money for a system that purposefully exploits physicians. And the well is dry kind of mentality of like, oh, sorry, there's not enough money to compensate you for X, Y, or Z, or, you know, your end of the year gift is a pizza party. I mean, it's almost comical. I mean, the things that my kids got from their teacher was more thoughtful than some of the corporate gifts that I've been given. And not that we even need a gift, but sometimes just the acknowledgement of like, hey, we really appreciated what you did this year. We saw that you worked your butt off. And even that goes by the wayside.
Yeah,
That's right. I mean, I think speaking to what Meredith was saying, we are a self-selected group of people who have decided to go sleep deprived, defer our financial situation, right? Like we kind of are a little bit of glutton for punishment type of people, really for, a lot of times just the honor of being a good doctor really like means a lot to us. So, I think that wanting appreciation is not, I think that's pretty human nature to want that. But I do think it puts us at extra risk of being abused basically within this system, because really we are used to being the ones who worked a little harder to do a little better and kind of put it onto ourselves. But really the companies that are employing us and the bigger structures are exploiting that by, work a little harder.
We know you're
Why
eager
don't you
to
get a
please.
little faster?
Yeah.
Exactly.
We know you want to be the best, so
they turn
let's make that harder to get.
Exactly. They turn the expectation of squeeze a little bit more and a little bit more and a little bit more out of the doctors, but then they're wrung dry and then they cannot provide care. And it's tragic because, if I look back at our med school, like graduating class, this is a group of people, all of these people you would want on your team, right? Like these are good people. Yeah. And so the fact that people, every party I go to, I hear probably 10 different stories, horror stories from people about their interaction with the doctor that was negative, callous, rushed, lacking in emotional sensitivity. It's because of this, right? It's not because they're insensitive human beings, but because they've been wrung out and really broken.
Tired.
Right? Yeah.
Yeah.
And we're just hoping that by talking about this, we can kind of bring the humanity back into the physicians, maybe turn the frustration towards the right sources, and then help patients realize when you go into a doctor's office, honestly, trying to have like one, maybe two things that you hope to achieve, like really, that's probably the most realistic.
Rein in the expectations.
Yeah, unfortunately. I used to do something where I basically would have patients schedule serially appointments so that, and each time they would come in, I would, we'd look at the list and we'd kind of prioritize one of the things on the list and hit that at that appointment, and then next appointment would be the next thing, and realistically I think that's a lot better way to get what you need out of healthcare than bringing the whole list in, because your doctor just unfortunately doesn't have the time.
Yeah, but it's unfair to the patient because that's a copay.
Yeah,
it's expensive.
Every time you have a high deductible, they're paying for that. So you're right. It's probably the only way in corporate medicine to get what the patient expects.
Yeah.
But I do like the idea of patients bringing in a list of their concerns. If I could give one piece of advice to patients, it would be to give that list to your doctor and together decide which of those things you're going to attack, because inevitably we have all been in a situation where the last thing on the list was chest pain.
Right.
And you don't get there and you're walking out of the room and it's like, by the way,
Right.
I have this horrible chest pain. And you're like, hold on a minute, let's address that real quick. So, it's important that not only what as the patient thinks is most important to address, but that we as the physicians can see like, okay, I know, your back pain is really upsetting you, but like you're having crippling chest pain. Let's maybe talk about that really fast.
Yeah.
Maybe they're related. But, I think it's like,
that's
important to work together to decide what we address and when, because it's not only important that as a patient you feel like your needs are met, but as a doctor, we need to make sure you're going to be coming back to your next appointment alive.
Yeah.
And so sometimes what seems important to a doctor is different than what's important to the patient.
Well, I think that sometimes like the priorities sometimes become a little bit malaligned, only because we're in the business of ruling out the things that are going to kill you. And as funny as that may sound, our mind is kind of like a doomsday when we're going through something called a differential diagnosis. So if I have a patient that's coming in for chest pain, like my mind is trained to go first to cardiac disease, right?
Yes.
Like the thing that's going to be the most imminently dangerous.
Correct.
And then we can go down the list. 9 out of 10 times, it's usually something related to like costochondritis or something related to musculoskeletal system or heartburn or something that's a little bit less emergent.
Not going to kill you. Yes.
Right.
But I do think that what I've appreciated with patients is that developing a rapport where we can have an open dialogue as opposed to it being like a list form. It's kind of like we can bunch constellation of symptoms together based on certain ailments. So a good one, for instance, is someone who's got high blood pressure that's not really well controlled. They're taking meds. And on top of that, they're complaining about fatigue, headaches, right? And then I can kind of look at that list and be like, hey, you know what all these things have in common is obstructive sleep apnea that you've never been tested for.
Right.
So let's start there. I don't think we need to work up the headache. I don't think we need to do this whole thing because I think these kind of fit together in a package, and then we can do that.
Super solid.
And then
point,
moving over to the next.
And that's why I like patients giving the list to the doctor, because it's like a puzzle.
It's true.
Correct.
And you can be like, okay, these pieces go here, these pieces go here.
Yeah.
And so you work together to like get to the end. But
Yeah.
the problem is, you know, sometimes patients go in and a doctor sees a list and they're like,
I was
It's
just going to
triggering.
say the
It's
trigger.
very triggering.
It's the trigger,
Yeah.
right?
And I understand that too.
Yes, the understanding. Yeah, it's mostly when you're right, bring in the list, because you're right that you can almost, I mean, half of the time you can take the list and actually, you know, realize what's going on, you know, clump them.
A beautiful mind.
Yes, exactly,
Yeah.
exactly. But the understanding from the patient perspective that this may shut down the physician, because really, what is our experience day in, day out? Being asked to do something, be asked to do something, be asked to do something. I mean,
Yeah.
it's like
Over and over.
mom job on steroids sometimes.
And it's not just in the room. It's the second you walk out of the room, right? There's someone
Yeah.
waiting for your signature. There's someone
Yep.
waiting for a phone call.
There's
someone,
always
something.
something.
Yeah.
And the kind of bigger those somethings look, the more overwhelming the physician can get. So if you do bring in the list, just, how you present it is really
Mhm.
important.
Mhm.
You know,
Yeah.
coming in, hey, I know you're limited on time. I know that we're not going to hit all of these things today, but I want you to be aware of all of the things that are occurring in my body. I think that you're going to get a much better received response from your physician. Trying not to go in with an expectation of for sure what you're going to get done without talking to the doctor
Yeah.
first and working as a team
Yeah.
to decide what that is a solid point.
And I think also that a lot of times these things don't happen overnight. If they happen overnight, we're usually talking about emergency room situation or a 6-day visit, right? Where there's something acutely wrong going on. Most of these things have been accumulating for many
Weeks,
months,
months.
if not longer. And so what I try to do is to reassure patients is that like these things didn't happen overnight. We're not going to solve them overnight. And giving them that space and that reassurance that we will get to it.
Yeah.
But I'm reassured by the fact that you are not having anything that I think is going to acutely harm you in this moment.
Right.
But it's a matter of just communicating that and saying that this is something that we can accomplish together, but
Right.
it's just going to take time.
Yeah.
It's hard because I hear that patients like don't have time or they're coming in from their lunch break or,
Correct.
you
Yeah.
know,
They're
I mean,
frustrated too.
in a
Yeah.
system that, a workplace system that centers itself around requiring doctor's notes for visits, which I find to be very archaic, but,
right.
why can't adults just be free to decide that they need the time off to go see a doctor or a dentist or whatever it may be. But I think that that is why I've cherished my time here at Thrive in the direct primary care model, because, and I recognize that it's a privilege. But Ingrid and I were just talking about this yesterday, how funny it is that we feel like we're the ones with time, like, okay, what else?
I know.
Go ahead.
I know.
Yeah,
Give it
people
to me
are
more. And they're like, I gotta go back to work, Dr. Babb. Like, but the time is the most precious resource that we have on this planet. And so to be able to give people time has been one of the greatest pleasures for me being in this system, because that is all that people really seek, right? Is just the time to be heard and to be validated. And as family medicine doctors, I think we're really, really good at validating people and hearing people, probably more so than specialists. I think just because that's just how we're primed going into family medicine or internal
Wired.
medicine or
Yeah.
pediatrics, right?
Self-selected,
And I think
yeah.
OB-GYN too, like OB-GYN is like another one that's kind of falls into that sort of primary care role sometimes. And I think that you develop a sort of way of just being able to listen maybe a little bit more attunely.
But I think we'd be remiss in speaking about time to not address when physicians run late.
Yeah.
Because, OB-GYN especially often runs really late. And there's very good reasons. They're usually at a complicated delivery or, surgery.
Right.
But from a patient perspective, as time is our most precious resource, you go into an office appointment that's supposed to be at 8 and you may not be seen till 9:30 or 10.
Yeah.
And you're angry.
Yeah.
Understandably angry. because your time is precious. You were there on time. I mean, we've all heard this. I was there on time. Why wasn't the doctor there on time? And being people that really want to make everybody happy, there is no bigger stress to me than when I am running late.
Yes.
I mean, I profusely apologize because it upsets me, and I'm not trying to say my time's more important than theirs, and I know that's what they're thinking, and I'd go down this rabbit hole in my head, but I would ask that patients have some grace, because I promise that if we are late, it is not because we were eating lunch or sleeping or texting or any of those things. It's because you're leaving a room and suddenly a patient has an acute emergency and you have to go call the ambulance, or somebody's seizing. I mean, things happen that do derail our days in ways we could never have predicted. And we do not have time in a corporate medicine day for the emergencies. It is, here's your 15 minutes back to back.
Right.
Most of the time that lateness is a product of the system.
Correct.
Not
and not giving us the grace
person.
to allow us to actually treat patients in emergent situations when we have to treat them.
Or to go use the restroom, for that matter. Like, I have to, at some point,
that's not even allowed in there.
No,
that doesn't happen.
There are so many days when I was in corporate healthcare where you would walk into my office by the end of the day. I had cold toast still sitting in the toaster from the morning. A yogurt that was opened with a spoon in it that hadn't even been touched. And then that was the morning. And then
and a bladder this big.
Yeah, right? Lunch would come around, and my medical assistant would so kindly like warm up my food, or she'd get my lunch prepared or whatever, and I'd have a bite out of it.
Nice,
and then I'd go on to see patients. And then by the time at the end of the day, I'd have a almost completely full lunch that hadn't been touched, yogurt that is now bad, and toast that is now cold and in the trash.
Yeah.
I tell people all the time, I started intermittent fasting completely unintentionally. 100% unintentionally. It was like
I'm already doing that. That's
5
cool.
in the morning, 4:30ish sometimes.
And then nothing.
Yeah.
And just because there's no time. Like,
right.
Why would you? And I'm so glad you bring this up. Like, it's funny, I'm married to a physician, and I noticed that we have never asked each other, why are you late? When one of us is late coming home.
Yeah.
Because we know. We just know. Like, there's
a reason.
There's a reason. And in fact, usually when they come home, it's like, how bad was it? How you doing is really the energy that we try to give each other, because if you're running late, it is because you were doing something important and trying to save a life one way or another. And yes, that sometimes takes time. And if you have 15-minute appointments, that's not always enough to do that.
Yeah.
So I really hope that people hear this without hearing, our complaining. It's more just we are trying to do the best that we can. And unfortunately, a lot of physicians, self-preservation mechanisms start to kick in as a means for self-protection. And that is really. Every time I hear a horror story about a patient's bad experience, I'm equally saddened by the other story, the other side of that, which is somebody who is not sleeping enough, is not taking care of themselves, no longer understands the signals from their bladder to use the restroom. And it's just kind of ironic that we're supposed to be the profession that is in touch with our bodies, and we have
totally silenced our bodies
and not taking care of ourselves really
in
so many ways, and that's really sad. But anyway, my hope is that things will slowly change with companies such as our own leading the way, but until then, that people can continue to have empathy for their physicians.
Yes.
I think one thing that I learned to do early in my career was to sort of always humanize myself to my patients. And I know this is sort of, some physicians are really against this, but I've always been sort of like an open book and very talkative about my family and my kids and what we're doing for the weekend. And because I think that sometimes what is maybe a boundary that physicians put up can also sometimes lead to the dehumanization of physicians, because people don't realize that like we have kids and we have families and we do like to go on vacation, and we do, you know, kids get sick, and so, you know, I'd have to call in sick, and I had a fellow male physician one time say to me, and I was like, I gotta go home. My youngest is sick, and he's like, don't you have a nanny for that? And I remember just feeling like there's so many things wrong with that statement, but like even a colleague like not having the grace to be like, yeah, go home.
Right, go home.
Right, go take care of
Oh
your kid.
my gosh.
Kid, you
I
know?
mean, one of the best gifts of joining this practice was the ability to write, like, block my schedule for like 3rd grade class play
Yeah.
and not have that be questioned. Like,
Or feel
Yeah,
guilt
or feel
that you're
guilty.
pushing away, you know,
That's right.
patients that have been waiting how long to
Months.
see you.
of course.
That was
Because I
always
can
the
still
worst.
see them.
Yeah, right.
I know, I get both.
Exactly.
Yes.
You get
Yeah,
both. You get both.
Because that was the thing that's really hard about being a physician that I totally forgot about until now, because we haven't had to deal with it here, is like you have to know your schedule so far in advance
Yeah.
for everything. And I'm not talking about trips. I'm talking about like, when is the spelling bee? Like, I
Yes.
remember at the beginning of every year I'd go to the office and I'd be like, I need dates, you guys. Like,
Right.
when are all the things? Like, when's the
Yes.
jogathon? When is the spelling bee? When is the,
Yes.
you know, like
Because you have to do it 6 to
the
9 months
dances?
in advance.
Right, because you have to block your schedule ahead of time so you're
Yeah.
not disrupting
Patient
patient
care.
appointments, because the problem is that you have patients booked so far out that when you have to cancel, they get put on something called a bump list,
Oh, it's the worst.
and it's a we hate it too. But a bump list is something that you go on when your appointment gets bumped, and then someone works that list and you could just get added to the end. The corporate system won't even allow you to have a bump list like buy-in time where every day has like a spot for 2
Right.
people,
Same day.
Prior bump
right,
lists.
that are like frozen slots, so that if people who get bumped can have a place to go. Because for me, like for primary care, I was booked like solid 3 months out. Solid.
Most, yeah.
Yeah.
I'd
And
say
so
that's true.
when
Yeah,
patients would get upset because I called in sick or my kiddo was sick, like I could understand why they'd be frustrated because they'd
100%.
waited so long for that
Absolutely.
appointment.
Yeah.
And I'm primary care. Imagine like a neurology appointment.
Oh my goodness.
Like neurology in our area is like almost a year
A
wait.
year.
Yeah,
And then to get
dermatology,
bumped?
any specialty. I mean, but think about how many times in corporate medicine we would go to work sick
Yeah.
Yeah.
when we should have called out.
Right.
Yeah.
But I probably could count on one hand in
Right.
13 years how many times I called out sick, because that guilt
Yeah.
of these patients that I care about having to be bumped when I know how much it means to them, I wasn't going to do it.
Right.
And that's
Yeah.
not good.
Right.
That's not a good thing for
It's actually
physician
not even
burnout.
for them.
It's
No,
not safe
I know.
for them.
I know.
But it's like, I'll
It
put on a
is.
mask and I'll just push through this
That's right.
because I'm not going to let you down.
Right.
And
Yeah.
that, I think, in a nutshell, is the absolute shell that is physician burnout.
Yeah.
Like,
Yeah.
I'm not gonna let you down,
Right.
and it's gonna be at the expense of myself.
Yeah.
Right.
And
Because ultimately,
Yeah.
by doing that, there's no such thing as like work not done today
it's
always
still
means work that gets put off till tomorrow,
Correct.
right? So
Yep.
like we get trained to be a machine to do all the tasks of today, because if you don't, no one else is going to do them.
That's exactly
They're
right.
going to
They're
be there
just gonna
tomorrow.
be waiting there.
And so
and 10 times
it's
more.
this hamster wheel of always being slightly one step ahead of the avalanche that's coming,
But you're always behind.
but you're always
I
behind.
was always in the
Like-
avalanche. I just lived in the snow, like rolling down the hill. I've actually had to untrain myself. Like my whole life for the last 10 years has just been deal with the most pressing issue
In the moment.
first,
Yeah.
because I can't get ahead to actually
Yeah.
plan ahead for
Yeah. And
less pressing
and
issues.
Ingrid and I have talked about this quite a bit over the past couple years, like what a depraved state to constantly be living your life
Mhm.
being behind.
Yes.
Like
Yes.
to always be like,
and
there was
and-
referrals I still have
and
to
you're
put
kind
through.
of a
There's
perfectionist too.
yes,
Of course,
Yes.
I mean,
yes, to some
Yes.
extent, right?
Yes.
And so that feeling of it
Yeah.
creates a sense of failure that like you just start
living.
Yeah. And it's really, that was a hard cloud to get out from under.
Yes.
And I think that you and I, more so than Meredith, but you and I still sort of exist in that space to some degree.
We have to remind ourselves and shake ourselves out of it because I was deep under the snow of the avalanche. Like,
Just the hands.
It's such a triggering feeling. Like even now thinking like when I have a patient who comes in and I need to send a referral for something, it's like this feeling of like panic, like, oh my God, my chart note needs to get done. Like all the steps, all the steps that need to be done. But now I can remind myself like, oh wait, I don't have another patient for an hour.
Right.
Whereas before I'd have like an additional 20 patients I'd still have to see who probably also needed their own referrals. Right. Or labs ordered. And so, I mean, I recognize the frustration that patients have, and it's so like rightfully so. Like there's I want to make that very clear.
That's right.
That patients
they're valid.
They're valid to feel the way that they do.
100%.
I think the anger is misplaced because physicians are the face of medicine, right?
Totally.
And so the people who really need to hear it are the corporate healthcare system. So it's probably going to fall on ears that don't listen.
Yes.
But, and as more physicians exit that space and start spaces like what we have created, I think the message will become more loud and clear. But the only way, I believe, and I thought about this for a very long time because I was unhappy for a very long time. I really, truly believe the only way that physicians to gain full autonomy of their career is by doing this.
100%.
And maybe a little bit going into private practice, but for sure going into direct primary care, DPC, direct specialty care, DSC, or for the bougie ones who are doing concierge.
But yeah, because it's taking the power away from what is dictating the current burnout, which is insurance.
Where
and
like
corporate
90%
medicine.
of the money is funneled.
Correct. So if we take that power away, we put it back in the patient's hands, we put it back in the physician's hands. Those are the two hands that really matter.
Yeah. Because how many, like think of how many patients.
And those are the two hands that are hurting.
Yes, I know.
That's what's so frustrating.
Think of how many outcomes you have had for patient care that have just been better.
Oh my
God.
gosh.
And I'm not talking about like, physicians missing things that lead to like a catastrophic event. What I'm talking about is like the blood pressure that was just always poorly controlled, or the diabetes that just could never quite get under control.
I have so much shame in this space where I feel like there's just so much I could have done had I been
had
here
time.
and had the time.
Yeah.
That I mean, yes. That's right.
Yeah. I mean,
there's a lot of lost opportunity for health that is happening by making us so rushed that we can't ever sort of deep dive into things, and it's.
But now we get to do that.
Yeah. And I would say the 3 disease states for me that have been the most impacted are obesity, hypertension, and diabetes. Those 3 I have seen like the most change in my patients.
Absolutely.
Like I had a patient who started here with me whose A1C, which is the marker we use for diabetes control, was like 10.2. And now she's at like 5.1.
I'm going to add polypharmacy to that.
Yes.
Oh yeah.
Too many meds. Like slowly chipping away at getting down on meds, dose decreases, number
and
of
still
medicines,
improving health state.
Improving health
You don't need extra medicine.
with fewer medications.
Yeah.
Correct.
It's huge. But
I know. It's like, oh, this is why we're in medicine. I remember now.
Yeah. It resembles what I
remember.
That
I can
altruism.
breathe and I get sleep and I get to see my children and still take care of people in the way they're meant to be taken care of. So
yeah. Well, I think I think it's the tide needs to change, and for physicians who are out there potentially listening to this, like. I think the solution is
solidarity,
direct primary care, direct specialty care for patients.
Hunger Games.
It's basically the Hunger Games.
And for patients is to if you can't find your way into a direct primary care office, then the solution is do try to create regular appointments with
and
your physician
that are realistic and have lists that you can talk, try and become a team with your physician in the short time you have. Work together as much as you can.
Yeah.
I think that sums it up.
Wonderful.
All right, ladies.
Okay.
As always, a pleasure.
Yes, thank you
Talk to
very
you
much.
Are we going to do an aging well tip?
Yes,
Oh,
okay.
yeah.
So a new thing on our podcast that we're going to do is at every podcast, I'm going to give one teeny tiny tip for something that you can add to your day, add to your life. It's little, it's not a big deal, but I want people to try to listen and do it. So today's tip is a little bizarre, but it is
I'm not surprised.
wash behind your ears, which is something
So
that
random.
like grandmas used to
Did not see it
say.
coming.
I mean,
I didn't see that. I just stood there like,
I thought it was gonna be walk
we
more.
can edit this out if we need to.
no, I don't want to. This
But
is
for
great.
real,
Please tell us why.
This
The
is
reason
our
why-
life.
Yeah.
The reason why is that mostly what I want, well, one, it actually does get kind of grimy behind there, and that's why grandmas used to always tell you to wash behind your ears. But the main reason is it's to stop your vagus nerve. It runs in this area, and there's a lot of people who are living in this world very, very tense and very wound up with their neurologic systems in the state that we were all living in when we were burnt out. And taking time to sort of, for those of you who can't see me, I am touching behind my ears right now and just sort of massaging around my ear. That taking just a moment to give this kind of feedback into your body can be really, really regulating to your nervous system.
I love this.
I
See,
know.
I've never done that.
That went a lot better than I thought.
I wasn't sure where we were going.
I
Told
wasn't
you,
either.
I'm a freaking genius.
You
Okay?
are. I love that.
Add to it,
Oh,
even
no. Here
better
we go.
if you have like rosemary mint
I knew we were gonna add
shampoo
some
or
kind of-
something, scented.
Yes.
And just
Yes, biofeedback.
right,
Got
getting
it.
a
Yes.
little biofeedback loop and a
Mhm.
little like reminder, and just being in the shower in itself is like a soothing place. I don't know when, but some point in my burnout process, the shower even became a stressful space where I would go through all of my to-dos and all the
Yeah.
things I was behind on, and now I have reclaimed this as a space for like
Relaxation.
right.
Nice.
And
I
this
like
is,
it.
This
Yes.
is my way
Age
to
well.
remind myself that that's what we're doing here in the shower. We're taking it easy and giving ourselves a little like neurologic reset. So there's
Love
the
it.
tip for this month.
Good
And
one.
come back for more.
Yes.